Dr. Michaels, you talked about children and that it really is relatively easy to, get them going, moving, no big deal, really, just as you said, very nice and clearly to the mom, just enjoy the baby. And people around like the MDs and everything, they will alert you if something is wrong, and when the first teeth come out, go and check it out with the dentist. But it's mainly a matter of getting the kid used to the dentist without doing anything. Tell us about sealants. Are they really as protective as they are? Are they used for the baby teeth? Are they used for the permanent teeth? Tell us.
Sealants are clear or tooth-colored plastic material that flows onto the surface of the teeth and seals out decay. Unfortunately, sealants don't work very good on baby teeth. They don't stick or last very long, so we tend to not use them on baby teeth, except in special circumstances. However, as soon as a permanent tooth pops through, it's a great idea to put a sealant on. They're relatively inexpensive. They're very easy to place. There's no drilling or anything, and they're easily tolerated by kids. They last 3, 4, 5, 6, 10 years, and while they're in place, they protect the tooth almost completely from decay. The idea is to get the child through those extreme decay years. There are these years between 6 and 13, 14, 16 years old when we tend to not have the best eating habits, when we don't have the best brushing habits. And these are the decay-prone years. And if we can get sealants on their teeth during those years and prevent decay from occurring, we can save lots of teeth and lots of headaches for that person later in life. Sealants really work.
So what you're saying, at around 14, 16 afterwards, sealants are really not anymore needed?
Well, I don't know if that'd be the case. I mean, their priority is the younger years. Some people have extremely deep pits and fissures. These are those deep grooves that we have in our teeth. And in those individuals, it's almost impossible to keep that clean. We have a lot of adult patients who have anatomy on the surfaces of their teeth that's like that. And we advise that they get sealants on their teeth because these deep grooves are thinner than the single brush or single bristle on your toothbrush, and it's just impossible to keep it clean. And eventually those are going to turn into cavities. So in that particular case, sealants are a wonderful option, even for adults.
Got it. Now, when you talked about those grooves, those little tiny dinky grooves, which probably are not seen with the naked eye even, are there children which have, some children who have more of that, and thus sealants are even more important than for other ones?
The presence of that type of surface configuration of the tooth is the principal determining factor as to whether a sealant is going to be of an advantage or not. If you have those real deep grooves and the very challenging surface anatomy of the tooth to keep clean, then you're going to benefit greatly from sealants.
I see.
Some people have actually relatively flat teeth with very few grooves, and in that particular case, the sealant may not benefit them at all or be necessary.
Okay, got it. Again, you're really shedding light on some questions which many of us non-dentists are having, and I'm sure are happy to know. Thank you very much, Dr. Michaels.
Thank you, Alan.